The following is a demonstration of a healthcare provider meeting with a pregnant adult who is open to quitting tobacco. Notice how the healthcare provider applies the 5 A's: ask, advise, assess, assist, arrange of tobacco cessation counseling.
Great. Well, I saw on your survey that you smoke some now, but you've cut down since you found out you were pregnant.
Yes, I know I should quit completely, but I am smoking less now that I know I'm pregnant.
That is great. It's a real step in the right direction to start to cut back. And quitting is one of the best things you can do for your health and for your baby's health.
Yeah, I'm trying to do all the right things. I'm taking my vitamins, going to these appointments, and I plan to breastfeed.
Oh, I'm so glad to hear that. It sounds like having a healthy baby is really important to you. Have you thought at all about quitting completely?
Yes, I would love to, but it just seems so hard. I've smoked for so long in the past, and it's only lasted a few days or weeks.
Yeah. Quitting is really hard, and we can work together to make sure you're successful this time. Tell me a little bit about when and where you use tobacco.
Well, like I've said, I've cut down a lot. So it's really just my drive to and from work, and also after dinner when I'm sitting outside on my porch.
So before and after work in the car. So you smoke in the car, and then also after dinner. Do you smoke after any other meals?
No.
Okay. What are some things you could do when you're in the car instead of smoking?
I'm not really sure.
Other people find it's helpful to have something to do with their hands, or kind of the hand to mouth thing, anything like that that could be helpful.
Well, maybe I could put some candy or gum in my car and chew on that.
Yeah.
Or maybe a lollipop.
Yeah, there's some great options out there. Okay, well, what about after dinner? That's your relaxation time.
Well, I know it's good to get some exercise in, so maybe I could go for a walk or do some stretching.
Yeah, and there's some great videos on YouTube for some prenatal stretching, so if you want to look up some of those for some ideas. I think those are all some really great ideas. So you will have you get some candy to put in the car, look up some stretches you can do after dinner. And something else you want to do is clean up. So you'll start to get more sensitive to the smell as you quit smoking. So you may want to clean up your curtains, some of your clothes, or if there's like a jacket you usually wear when you smoke, you'll want to clean all of that. And get rid of any ashtrays or lighters in the house. Get them out and throw them away.
Yeah, I can do that. Wait, actually, I can't because my husband smokes as well.
Oh, yeah.
Maybe I could get him to quit with me.
Yeah, that would be great. You could support each other.
Yeah, I think that would be really helpful. He's just like me, so he knows he should quit and all that.
Yeah. Well, let me ask you, what is going to be good when you quit smoking? What's going to be good about quitting?
Well, I'd save a lot of money that could be spent on my baby. And I think I'd just be proud of myself for being able to overcome something that I've wanted to do for so many years. I think I'd be really, really proud of myself.
Yeah, and you should be. Quitting smoking is a really big change and a really positive one. And it sounds like, there'd be that I'm very proud of myself, and you'd have some extra money at a time when money's going to get a little tight. So that all sounds great. I want to give you some information. I do have a booklet here for people who are pregnant and are thinking about quitting or cutting back smoking. I also have a resource for your husband about quitting. And the other thing I want to do is, if you're open to this, connect you with the Quit Line. The Quit Line is a free service that has coaches, trained coaches who can work with you while you're quitting, both before and after baby comes. And they're available by telephone or text message 24/7. Would you like that extra support?
Yes, I definitely would. I think that'd be helpful.
That's great. Well, I'll get that referral in, so they'll be reaching out to you, and we can plan to check in on how you're doing the next time you come in.
All right. Hopefully I'll have all good news.
I hope so too. And even if you run into any bumps, I still want to talk about it to make sure that we can help you keep going in the right direction.
Okay. Thank you so much.
You're welcome.
Visit youquit2quit.org for free resources for your practice including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5As and 5Rs in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's youquit2quit.org.